Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about ingrown toenails. And we're going to do this actually for the next 6 days. What I'd like to do, because we've done multiple of these podiatry tips, and what I would like to do for for podiatry tip day 211, what I would like to do is actually go through the process now of teaching you a little bit more depth about some of these things. For the next 6 days, we're going to talk about ingrown toenails. So today we're going to talk about what is an ingrown toenail. What is it? So the idea is you need to understand what a toenail is, or how the toenail is. And so we'll use a fingernail just to kind of see if you've got this, you've got the nail plate itself. You get the lunula where it grows from, and then you have the borders of the nail on either side, this side, that side. And the nail itself is attached for a majority of the nail except for the very tip, and that's why the coloring changes. Underneath the nail is the nail bed where the nail grows from, and this sits right on top of bone, basically. So this is the anatomy of the nail. And nails genetically can form in multiple ways. They can be completely flat, they can be slightly rounded, which is pretty common, or they can be really curved. And then you can actually change that by doing several different things. If you have a bone spur underneath, like an enchondroma, you can actually push up on the center, and that will cause the nail to curve a lot more. If you get a fungal infection, similar to what this fungus that causes athlete's foot, you get onychomycosis or fungal infection of the nail, that can push the center up as well and cause it to curve. Sometimes age itself will cause the nail to curve as well. So in those kind of cases, then you'll get to curve, and sometimes you'll get an ingrown toenail just because the nail is curving and can even get to the point where it's curving underneath and causing some issues that way. Other reasons why you can get an ingrown toenail. The point is, the whole definition of an ingrown toenail is the edges of that nail are catching. So either they're catching themselves, or the nail's broken and you've got a little piece of the nail that's catching on the skin and starting to grow underneath the skin. You can get a hangnail, which is a little piece of the nail that is in that area that starts to be irritated and problematic. You can get a whole piece of the nail that's growing underneath. You can get the fact that you've trimmed the nail too short. So if the idea, most of us curve our fingernails. With toenails, you want to cut them straight across. The way I described it is that you cut it straight across, then you take the corners off, and that allows you to treat it, to keep it from getting ingrown. But the problem is, as soon as you step down, it pushes the skin up around the edges of the nail, and sometimes you can get an ingrown toenail for that reason. So by definition, an ingrown toenail is the edges of the nail catching and growing into the skin. So there are basic anatomy information about the nail. The nail grows from the lunula, from where it's growing from out. It doesn't grow from the sides. So cutting down the center, doing any of that kind of stuff doesn't fix it, because it's growing from one end out. And so it's really just catching those as it's growing out, is catching those edges of the nail. And once you get that portion of the nail growing, it'll irritate the skin. The skin starts to react, starts to treat it like a foreign body, like a sliver, and it will get inflamed and swollen around it. Sometimes this is just an inflammation. If it goes on long enough, or as is usually the case, if we mess with it too much at home, doing bathroom surgery or whatever, it can get secondarily infected, and then you've got an infection and an ingrown toenail, with the infection sitting over the top of that. So you got an ingrown toenail, which is the nail growing into the bed. You can get an inflammation from that ingrown that can be secondarily infected and get an infection over the top. This is definition of an ingrown toenail, and it can be a big problem. Starting tomorrow, we'll go a little bit more in depth and kind of help you understand what you can do for an ingrown toenail, what kind of things you should do to treat it, and so forth. And as we continue to go through this, we're actually talk about some of the other things that can be done as well to alleviate symptoms, and also long-term what you can do in treatment thereof. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 211. What is an ingrown toenail? Thank you, and have a great night.